Which vaccine is given at birth to prevent tuberculosis? The answer is B. BCG. Which vaccine is administered within 24 hours of birth? The answer is B. Hepatitis B birth dose. At birth, OPV is given as. The answer is B. OPV 0 dose. Pentavalent vaccine protect against? The answer is C. 5 diseases. Pentavalent vaccine is given at? The option is B. 6, 10 and 14th week. Rotavirus vaccine is first given at? The answer is B. 6 weeks. Fractional IPV is given at? The answer is B. 6 and 14th week. PCV is given at? The option is B. 6 and 14th week plus booster dose at 9 to 12 months. MR vaccine is first given at? The option is B. 9 to 12 months. Second dose of MR vaccine is given at? The answer is C. 16 to 24 months. DPT booster dose 1 is administered at? The answer is C. 16 to 24 months. OPV booster is given at? The answer is C. 16 to 24 months. DPT booster 2 is administered at? The answer is B. 5 to 6 years. TD vaccine is given at? 10 years and 16 years. Japanese encephalitis vaccine is included in UIP for? The answer is B. JE endemic district only. Vitamin A first dose is given at? The answer is B. 9 months. Total number of vitamin A dose under UIP is? The answer is C. 9. Which vaccine is administered intradermally? The answer is B. BCG. Which vaccine is given orally? The answer is C. OPV. Which vaccine protect against cervical cancer? The answer is B. HPV. Which vaccine is given to prevent diphtheria, pertussis, tetanus, hepatitis B and HIV? The answer is B. Pentavalent. The interval between pentavalent doses is? The answer is B. 4 weeks. OPV is administered by which route? The answer is C. Oral route. BCG vaccine is administered by which route? The answer is C. Intradermal route. Pentavalent vaccine is administered by which route? The answer is C. Intramuscular route. MR vaccine is administered by which route? The answer is B. Subcutaneous. The birth dose of hepatitis B should preferably be given within? The answer is C. 24 hours. Which vaccine leaves a characteristic scar? The answer is C. BCG vaccine. Which vaccine is not given at birth? The answer is D. Pentavalent. Which vaccine is first administered at 9 to 12 months? The answer is A. MR1. Vitamin A first dose contains. The answer is B. 1 lakh unit. Subsequent dose of vitamin A contain. The answer is C. 2 lakh international unit. Which vaccine prevents poliomyelitis? The answer is A. OPV and IPV. Which vaccine prevents Haemophilus influenza type B infection? The answer is A. Pentavalent. Booster dose of PCV is given at. The answer is C. 9 to 12 months. JE vaccine under UIP is given in. The answer is B. JE endemic district only. TD vaccine replaces which older vaccine in UIP? The answer is B. TT. Second dose of JE vaccine is given at. The answer is C. 16 to 24 months. Which vaccine protect against pneumococcal disease? The answer is A. PCV vaccine. Which vaccine is administered as fractional doses under UIP? The answer is B. IPV. Which vaccine is given at 6, 10 and 14th week? The answer is B. Pentavalent. At 16 to 24 months, which of the following is not given under UIP? The answer is D. Hepatitis B and birth dose. Which vaccine is given to prevent measles and rubella? The answer is B. MR vaccine. Which vaccine is administered orally at birth? The answer is C. OPVO. Which vaccine is administered intradermally over the left upper arm? The answer is A. BCG vaccine. Fractional IPV is administered by which route? The answer is C. Intradermal route. Which vaccine protects against rubella? The answer is B. MR vaccine. DPT booster 2 is administered at. The answer is B. 5 to 6 years. The answer is B. Diphtheria and tetanus. Which vaccine protect against pertussis, whooping cough? The answer is A. Pentavalent. Rotavirus vaccine protects against. The answer is B. Severe diarrhea. Which vaccine protect against hepatitis B under UIP? The answer is pentavalent and birth dose. The primary purpose of BCG vaccination is to prevent. The answer is B. Severe form of childhood TB. Which vaccine is not administered by injection? The answer is B. OPV. The second dose of MR vaccine is scheduled at. The answer is C. 16 to 24 months. Which of the following is a live attenuated vaccine? The answer is A. OPV. Which vaccine protect against Haemophilus influenza type B meningitis? The answer is A. Pentavalent. Which vaccine is given as a booster at 16-24 months? The answer is B. OPV booster. Which vaccine is not included in the birth immunization schedule? The answer is D. MR vaccine. Which of the following statement is correct? The answer is C. The first booster dose of DPT is administered at. Which vaccine is administered at 10 and 16 years under UIP? The answer is B. TD. Which disease is prevented by the BCG vaccine? The answer is B. Tuberculosis. The pentavalent vaccine protects against all except. The answer is D. Measles. Which vaccine protects against pneumococcal pneumonia and meningitis? The answer is A. PCV vaccine. The first dose of vitamin A is administered with. The answer is MR1. Which vaccine is given at birth 6 weeks and 10 weeks, 14 weeks and as a booster at 16 to 24 months? The answer is B. OPV. The main purpose of OPV is prevention of. The answer is B. Poliomyelitis. Which vaccine is included in the UIP only for JE endemic district? The answer is B. JE. Fractional IPV is administered in. The answer is B. 2 doses. Which vaccine is administered subcutaneously? The answer is A. MR vaccine. Which vaccine is given intradermally? The answer is B. BCG. Which vaccine is administered intramuscularly? The answer is B. Pentavalent vaccine. Which vaccine protects against rotavirus diarrhea? The answer is B. Rotavirus vaccine. Which vaccine is not a live vaccine? The answer is D. Hepatitis B. Under UIP, TD vaccine replaced. The answer is B. TT vaccine. Which vaccine should ideally be administered within 24 hours of birth? The answer is A. Hepatitis B birth dose. The second booster against diphtheria, pertussis and tetanus is given at. The answer is B. 5 to 6 years. Which of the following is correctly matched? The answer is OPV oral. Which statement about the Universal Immunization Program is correct? The answer is C.